Hello, everyone. Welcome to our Digital Scholar webinar here, hosted at the Southern California Clinical and Translational Science Institute, the University of Southern California and Children's Hospital, LA. My name is Eric Peterson. I'm the co-director of Digital Recruitment and Scholarship within the SCCTSI. I'm also an associate professor of psychiatry and behavioral sciences here in the Keck School of Medicine at USC. Before I introduce the speaker today, just want to thank everybody for coming and let you know that the speaker is going to have time for some questions and answers at the end of the talk today. So please use either the chat or the Q&A function. I will help facilitate those questions, so you can type them in whenever they come up. You can wait till the end, or you can reference a specific slide, whatever it is. I'll keep track of those and facilitate a discussion towards the end of the talk here. So today we're really excited to host Dr. Allison Booth, who's going to talk to us today about understanding and using Prospero. Dr. Booth is a senior research fellow in the York Trials Unit and also an advisor and impact lead for the National Institute for Health Research's Research Design Service, Yorkshire and Humber. Dr. Booth joined the York Trials Unit in October of 2015. She has much experience designing and conducting a range of research methods, in particular systematic reviews, randomized controlled trials, and also methodological studies. She has a background in radiology, clinical governance, and research ethics. And her particular interests are in knowledge translation, impact, and transparency in research reporting. So we are very excited today to host Dr. Booth, and I will turn it over to her.
Hello, and thank you very much for inviting me. I'm very pleased to be able to give you a whistle-stop tour of Prospero. It started in about 12 years ago. So obviously it's a register of systematic review protocol details. But the question to start with is, what was the need for prospective registration? So systematic reviews usually provide the evidence base on which health and social care decisions are made. So they should be robust and free from bias. And health research resources are finite and getting more so. So they need to be allocated carefully, and we need to avoid unnecessary or unplanned duplication of effort to maximise the use of those resources. So the registering systematic reviews can help with reducing publication bias. So in 2009, 10, 11, it was suspected that it was likely that, just as for clinical trials, there may be publication bias associated with systematic reviews. But because we didn't know what reviews were being started and not published, it was sort of guesswork at the time. There was evidence that unpublished systematic reviews existed from a survey that Andrea Trico and colleagues did in 2009, where 12% of respondents said that they had completed reviews were unpublished, and the reason they gave was lack of time. And then in 2009, the PRISMA statement advocated registration as something that should be reported in a systematic review. Another reason was because of reporting bias. So emerging evidence that reporting bias is similar to those observed for clinical trials were also operating for systematic reviews. So Jamie Kirkham and colleagues looked at new reviews from 3 consecutive issues of the Cochrane Library, and 22% of 288 review protocol pairings were discrepant in at least one outcome. So they'd actually changed the planned outcome, and they'd either upgraded it or downgraded it or hadn't reported it at all. So prospective registration of systematic reviews could guard against bias in the same way as for prospective registration of clinical trials. So it can do this by facilitating transparency. Registration provides a permanent public record of key features of a systematic review, even if the completed review is never published. It enables a comparison of what was planned with what's reported, and it means that you can assess if any discrepancies are likely to have introduced bias. Encouraging clear reporting of any changes with justifications was hoped to be a byproduct of having registration. Reviews registered prospectively could have an audit trail of amendments, because it's not unreasonable to make changes to protocols. They are iterative documents, but it's essential that you record what changes were made and at what stage they were made, so that, again, an assessment of what the impact of those changes and any biases they might introduce might have on the reliability of the findings. And finally, registration can have the unique registration number that's linked to a registration, enables linkage between the record and the review publications, so that they can be connected up easily. Another aspect of having a single register was to try and reduce duplication of reviews. So unplanned duplication of reviews is a waste of resource. There was a study that showed that of 73 meta-analyses, 2/3 had at least one overlapping meta-analysis, and some of those were by the same authors. Ian Chalmers and colleagues called for sources to identify research in progress, and obviously this is registration is one of the ways in which that could be done. So registration allows those planning reviews to check whether there are any ongoing reviews that address their topic or specific question of interest, and it offers opportunities for collaboration. I should say that searching for ongoing reviews is also something part of justifying any research that you're going to be undertaking, and to look at whether there is an existing systematic review. So it isn't only of value to those undertaking systematic reviews. Apologies. This is so the other thing that it does is offer opportunities for collaboration. That's a duplicate slide. Apologies for that. The requirements of a register. So when we started building PROSPERO, we were very fortunate that we had people who trailblazed by setting up clinical trials registers. So we went to the criteria that were established by the International Committee for Medical Journal Editors, and the key requirements that were relevant to our proposed register was that it should be searchable and accessible to all. It should be free to use. It should accept registrations from anyone. It should require the provision of a minimum data set, that entries should be validated, at least for scope and completeness, and it should provide a unique identification number for each record. And finally, that entries should be permanent. So with those criteria in mind, we set up a small international advisory group, and we worked to establish a minimum data set. What we wanted was something that should not be overly burdensome, because I think any researcher will acknowledge that we do have an awful lot of hoops to go through in order to actually even start doing research these days. And we knew that this might be a potential barrier to people actually registering. So what we aimed was to collect sufficient information to enable informed judgments about the potential risk of bias, and determine whether reviews already in the pipeline met the identified need without having to undertake a new review. The idea was not to capture the wider information that should be included in a full protocol of a systematic review. So for the international consultation, we aim to inform the design of the register, reach consensus on the data items required for registration, generate support for registration, because we had no idea whether people would go for it or not, and to raise awareness of what we were actually planning. And so we undertook a modified Delphi exercise with a huge range of participants. Sorry, where my slides are going. And the full details of the modified Delphi are published in one of our papers. So if you want the full gory details, that's where to head. The outcome of the consultation was to establish 40 different fields, and 19 of these were related to the review design fields. So you can see the PCOS type items here, and the ones with a little asterisk are the fields that the consensus said should actually be mandatory and therefore have to be completed for every registration. So in addition to the review design fields, there were 21 administrative fields, which actually helped to ensure that ownership of a record was clear, and to make sure that somebody took responsibility for it, and that we could start to look at what sort of reviews were being done, where they were being done, and other relevant information, including things like funding sources and conflicts of interest. So Prospero, which I have to tell you is not an acronym. We couldn't come up with an acronym. It's actually a name for the database. It was launched in February 2011. It is web-based, it's free to search, it's free to register. Registrants create, amend and update their own records, and the minimum data set has to be completed. You can't submit if you haven't completed the mandatory fields. The record content is the responsibility of the named contact. So whoever registers and creates the record in their space is responsible for its content. The administrators check for sense only. There is no peer review, and each record, when it's submitted, is given a unique identification number, which is permanent, as is the entry in Prospero. So what will you find when you go there? You'll find systematic reviews of interventions, diagnostic accuracy, prognostic factors, prevention, epidemiological reviews, public health, service delivery in health and social care, and you will find systematic reviews of methodology, as long as there is a human related health related outcome as part of that review. You can also find some Cochrane reviews. There was a mechanism set up so that new Cochrane reviews could be added, so that again you only needed to search Prospero if you wanted to find out whether there was an ongoing systematic review. Unfortunately, for technical reasons, that hasn't been operating since February 2020. So you do need to go and search in the Cochrane library as well. And in about 7 or 8 years ago, I think, just before I left CRD, we started work with Circle and Camarades in Edinburgh to incorporate systematic reviews of animal studies for human health. And so there's a growing number there. And that's operated as a separate system by the Circle Camarades team. Sorry, the numbers there were the numbers of different review types. So as you can see, there's a considerable number of systematic reviews of health outcomes, health topics. So, sorry, I think I have a very sensitive mouse. I must stop playing with it. If you're searching Prospero, there's no need to log in. you can access all the facilities within without the need for a login. You can use a mesh interface if you wish to, and Prospero has its own search filters for health area of review, type and method of review, the source of the review, the status, the restrict the search to specific fields within a record, and you can also look for the date added to Prospero. Because of the number of registrations related to COVID-19, the team have built some special filters specifically for COVID-related records. And so there is an option to go straight to that if that's your topic of interest. So this is the search screen. You can search I forgot what this bar is called. Sorry, on the bar at the top, which is you see all the time. You can click on search, and it'll bring up this page. If you want to look at the COVID filters, you just click on this link here, and it takes you to the page that you've seen on the previous slide. Sorry. I've just typed in social prescribing here. I've this normally says show filters. I've clicked on it, and it toggles with then hide filters. These are the filters that I've just listed. I've clicked on source of the review. I've excluded animal reviews. I've put in social prescribing, and I've clicked go. So down here, I've got 53 records for social prescribing, not animal. It lists them here. If there were Cochrane reviews, you would see the Cochrane symbol. If there were animal reviews, you would see a little green mouse. And you can also see here whether the review is completed, ongoing, completed and published. You get 50 records to a page, and obviously you can scroll through the pages here. If you wanted to do a mesh search, you just click on the mesh button, and that takes you to the mesh searching. And if you want to clear your filters and start again, you click here. If you want to look at your search history and you're doing something more sophisticated, you can click on this button. What you can't do is save your searches. That isn't a facility that's available. What you can do is export your export the records that you wish to. So you can select the ones down this side and then export. This box comes up if you click on export, and you can choose how you want to do that. Exporting to RIS, you can then import straight into EndNote. So, registering a review. You do have to join or log in on the home page in order to register your review. So here you'll see that I have logged in, and it now gives me the option of registering my review. Sorry, you have to go to my Prospero, which takes you to this page, and you can click on register your review now. That brings up this page, and there are a number of steps here which you need to follow before you can actually register. So, step one is about eligibility. So Prospero includes details of any planned or ongoing systematic review that has a health-related outcome. So just make sure you've got a health-related outcome. The exclusion criteria are that if it doesn't have a clear relevance to the health of humans, if it's a scoping review, if it's a literature review, even if it's using a systematic search. Systematic reviews assessing sports performance as an outcome are excluded, and methodological reviews that assess only the quality of reporting or do not have an outcome of clear relevance to the health of humans are also would also be rejected. So step two is that the full protocol should be ready or nearly ready before registering. and submission must be before data extraction commences. That's a change from the original, where we were a little bit more relaxed about what the time would be, because we had no idea what the response to registration would be. And it's linked to the earliest possible time that biases might start to be introduced. So ideally, you would be looking at before formal screening against the inclusion criteria begins. Forms must be complete and they must be in English, but you can attach attachments in another language. And then steps 3 and 4 are for you to search Prospero for existing registrations. A, to make sure that one of your colleagues hasn't already done it, and B, to make sure that you're not repeating something that's already been done, or that if it has, that you're able to, within your application, justify why you're repeating it. And there are obviously very good reasons why some reviews are apparently duplicated, but it has to be planned and transparent. So that then takes you to step 5, which is to start registering your review. And obviously, if you want an animal review, if you're looking at animal studies, you click on the little green mouse. And if you would like to register a systematic review of health research studies, then you click the little purple man. That then takes you to this series of questions which have yes and no answers, and you follow those down until you reach stage of review. And this is crucial, because this is where what you say here will be entered into your form when it appears. So you need to make sure that you haven't started data extraction, or it will reject you. You then click on register your review, and you finally get to your registration form. So, as I've said, the form has 40 fields. It's a single form. You scroll through, so you can type as you go down. You can go backwards and forwards. You can cut and paste from another document if you've got your protocol already. And you can, in between, save your form as a PDF. If you want to share it, you can print it off. You can each question gives you brief information about what's expected, and if you want to know more, then you just click on the little eye icon, and it'll give you a more detailed description of what's expected in that field. You can also go to how to register and download, or have a look at full guidance. And there's some very helpful information on all of these pages for anybody using and accessing Prospero. You can, as you're filling the form out, you're given the option of actually uploading a PDF of your search strategy, or putting in a URL to it if you've got it stored somewhere else. And you can also upload a PDF of a published protocol. So when you go to My Prospero, when you have some records, this is obviously my page. So this is a title that I'm using for this exercise, which I've created. I haven't put a title in yet. So this is what's ongoing, and these are ones that I've registered and are in the database, and I know 3 they're all completed and published. I'm very pleased to say that's a relief, except for this one, which we were going to do and then didn't. So it's there permanently now. but you can, at this stage, you can delete a record if you've created it and you no longer want to go ahead with it. So on this page, you can go to edit your details. So if you change your title, name, address, where you're working, anything like that, you can go in and update that. Excuse me. And you can, for records for here, this little symbol here takes me to the email correspondence that I've had with the administration system assistants for that individual record. So Prospero's public interface, once your record's been accepted, it's published immediately on and is immediately available on the Prospero site. It looks different to obviously the registration form itself, and the order in which information is presented is different because we've prioritised what we thought that readers of records would be more interested in. So all the method stuff is right up at the top, and a lot of the admin stuff is towards the end. Be aware that the named contacts details are available in records. So you have to give your name and you have to give a working email address. Otherwise, you do not have to put your phone number or your address in. You can put your work address in, but just bear in mind that this goes into the public domain. And again, you can save or print your public record. So with Prospero, we've had quite a lot of challenges, and one of the major ones now is the volume of records. So in October 2019, there were around 55,000 records within Prospero, and they that's just for the health related ones, and just the other day when I looked, there are 133,216. So the volume has grown exponentially ever since launch in 2011, and there are there's a huge amount of duplication. There's no doubt about that. So there's a paper that's literally just come out, just looking at COVID systematic review records in Prospero alone. And they've concluded that a massive number of the reviews on COVID have been conducted present various characteristics, that many of the assessed records were poorly reported, and that it would be difficult, if not impossible, to replicate them. And so we can see that unplanned duplication occurs. What we can't see is where it's prevented, and that's always been one of the challenges, is to see whether actually having a register does actually prevent duplication, because people don't report to say, oh, well, I was going to register my review, but I'm going to do a different title now. We know of the odd occasion where funders have actually come back to us and said, oh, thanks, we found this, we're not going to fund this title, we're going to fund something slightly different or something completely different. So we know it does happen, but we have no idea to what extent. So another issue is the level of detail that's contained within Prospero records. So we looked at in 2016, Andrea Trico and a few of us looked at the differences between what was put in a published protocol and what actually went in the registration. And so 96 reviews were included, and 91 had not published their protocol in a journal, which made Prospero registration the only source for planned methods. So it was the only way that you could actually assess whether any biases had been introduced during the process of carrying out the review. The incomplete records is another aspect where there's a significant shortfall in items reported compared to those recommended in PRISMA P. So PRISMA P is the reporting guideline for systematic review protocols, and what we did was actually look at a cohort of Prospero records that did not have a published protocol to see whether you could actually, say as a peer reviewer, use the the Prospero record to actually compare what was done with what was planned. And the answer is that it's no substitute for the published protocol for identifying potential biases, because there was the absence of information in so many of the fields that would facilitate that. Meant it just wasn't viable. So one of the learning things from developing, the time when we developed Prospero to now, is actually understanding how things have changed, understanding the language, because there was nothing like it. There was nowhere to register or make protocols available for non-Cochrane or Campbell reviews, other than those that were funded by major funders who tend to make them available on their own websites. Understanding, what was actually available and what we actually needed to have in a protocol registration as opposed to actually in a protocol, and balancing that against not putting people off registering, because we felt that registering something was better than the status quo at that time, which was nothing. So the future, there are lots of new opportunities for transparency, and so one of the things that I believe the CRD who run Prospero are looking at is whether they can use machine learning technologies and text mining to speed up the checking process and the validation process in order to make it more efficient. There are also now lots of open data repositories, and these are great because it means that everything for a study can be in one place. It means that transparency in every aspect, including the raw data for studies. It would be great to be sharing data extraction tables and not repeating that for updating reviews, for example. But it does mean that there's no single searchable site for ongoing reviews, so it makes it harder to check that somebody isn't already doing the work that you want to do. There are drivers for change, so again, limited resources need to be used wisely, and the public are now more aware, and they're asking the right questions about research, about why we're doing the research, what we'll gain from it, and wanting to know what the outputs are, wanting to know what the impacts are for them, and wanting it in language that they understand. So I think the more the public ask, and I think that's one of the benefits of all the research that's gone on with COVID, is that the public are aware of just how powerful good research is. And if they're now asking the questions, why is there bad research, that can only be a force for the good. So I'm really sorry, I have rattled through that rather quickly. Thank you very much for listening. I can see that there are some things in the chat. I'm more than happy to talk if there's any questions. And if you want to put anything in about Prospero in the chat, that would be really helpful. Thank you. And just to say that there is a slide with all the references that I've used at the end here.
Great. Thank you, Dr. Booth. Really appreciate that. It was a really helpful tutorial taking us through. And just so you know, we record these and we post these on our site. So, I mean, this is something that people could come back to, when they're actually going to register a review and have you take them through the process. So we really appreciate, this would be a great resource. So I've got a question or two, and then if anybody else has any questions they'd like to respond to, let us know. I also put some questions into the chat. So anybody that's involved in systematic reviews or activities now, if we'd be interested to hear from you, we won't call you out specifically. I might just read your response. And also be interesting to hear if people are interested in using Prospero in the future, and if so, how, and if you need any advice on using it.
I'd be really interested to know if people are using the open data platforms and how useful those are, and whether they're more flexible, more user friendly. I know I've used one for a piece of methodological research, and actually being able to put everything there together, I thought was really good. And I'm not going to be offended if anybody says that Prospero's had its day. I don't work on it anymore, but I think it's been a really interesting look back over what's actually happened over the last 12 years, and just how much the landscape has changed, and how much the push for open access and availability of protocols, raw data, more information than when there was ever available in a published print journal. The fact that we now have less restrictions on word count, but we have to balance that with actually making it readable, not losing the message. And so I think there's some really quite exciting times around about how we can actually move forward. And it's a bit off the subject, but for example, we still need the final report. We need to know that a review's been done and completed and reported. We need to know that it followed a protocol, a planned methodology to minimize biases. But we also need to know that the findings are actually being used and are useful for the end reader. And so I would always say you need those reports. And yes, research impact framework. Do you have that in the States? Yeah, that's a major driver for us as academics. But I think more and more, we not only need to have that sound academic basis for our arguments, but we need that to underpin some lay summaries, some brief summaries, something that is going to actually reach the people who need to know about it. So
Great.
yeah.
Yeah, no, it's really interesting to bring that up, because it's a topic that we have been interested in pursuing kind of these lay summaries, because I think you're absolutely right. Like, we want to get everything as academics, we want to get everything in there, and it's like, oh, we have the space to put everything in, but you have to make it digestible, not only just so people will read it, but then also just so people can understand it, and people that are, that might not be their area of expertise. And so, we're always interested if you have any recommendations, or anybody on the webinar today's recommendations for somebody that might come in and talk about, how do you take, especially, for people that have created these really long research reports, how do you then whittle that down to a summary that can be digestible, on a website, on Twitter, wherever it's going to be.
One of the things we used to do in CRD were things called effective healthcare bulletins, and these were aimed at GPs. They were paper-based, and they were sent out in their thousands, and they were basically based on systematic review outputs, and the front page was just a list of bullet points of the key messages, and then inside it was a lay description of what we actually did. So clinicians do want to know that we've done this robustly, but they don't want to know the finer detail unless it happens to be their topic. And then so you can reference the full systematic review reports, and if they want to go, they can go there. And I can see us coming full circle back to exactly that sort of format, possibly not in paper, but certainly a summary format.
Oh, that's great. That's really cool. Okay, I had a question for you. I think, maybe more coming from your experience conducting systematic reviews, but I know you had talked about that there's quite a bit of overlap, especially with the COVID stuff, but just in general. And so being able to search through this database and seeing what's been done out there. A lot of times when people want to do systematic reviews, I've done a few in the past, and you started with this idea that's just massively broad, and then you realize, like, wait a minute, if we do that, we're looking through hundreds of thousands of papers. So it just whittles down, and it gets more and more specific to where it's so specific, but you're still looking through tons and tons of papers. Yeah. So I guess there's two questions here. Like, one is how much overlap are you really looking at? Like, and I can't really give a great example, but if, let's say, you were interested in kind of this broader topic, and then you realize, oh, somebody's already done something on this broader one, but I want to get something a lot more specific. But then also the other question is, like, if you find something and it is the exact topic you want to do, at what time do you then propose to do an update to it? Like, how long do we wait until we start to update the literature?
Okay, they're both a bit how long's a piece of string questions. So thank you for that. The first one, how much overlap is an overlap? I think it's very hard to say, but you're really looking at will your question, how you're proposing to look at the same question with your tweak to it, is it going to come up with a different answer? Has it got any chance of coming up with a different answer? What sort of literature is it that you're going to include in addition to, or which parts of the included literature are you planning to exclude? And is it actually going to make a difference? Because I think sometimes if the differences in the questions are so nuanced, you're not going to make a difference. I think if you found a broad topic review and you want to look at a very specific one, you have to ask yourself, did they find enough on my narrow question to actually make it worthwhile doing this? Did they do some subgroup analysis on what I'm interested in? That sort of thing. But I guess also it depends on what their outcomes were, and whether you're looking at a different set of outcomes. And again, that you really have to ask yourself, is this going to make a difference? Is it going to come out with something different? Or am I asking a different enough question so that if I come out with the same answer, I can still justify why I've done it? And I'm sorry, I've forgotten the second question.
Second question was more related to how do you know when it's a good time to do an update? So
timing for an update.
Yeah.
Well, usually people are doing something on a topic area that they're interested in and they know the literature about. So if you've spotted a few reports coming out, a few publications, or one really lovely big RCT that's just been published, that's your time.
Okay.
So you can always do some scoping searches to see whether from the date when your first review, your published review ran their searches up to the present day, and just run a quick search and just to see if there's anything really that might actually be big enough, or there is a number enough that is actually going to make a difference.
Great, thank you. That's really helpful. So I'm not seeing any more questions. So I think we can wrap up. But I want to direct everybody to the chat. We have a brief survey that you could complete. Please, it just take a few minutes, or less than a minute actually. Just what you thought about the webinar today, but also just some ideas you might have for future webinars. I'll mention that we are not going to have a webinar in December, but we'll be back in January, I believe. And we will keep an eye out for some emails and some announcements from us related to those. So thanks everybody for attending. Thanks to Dr. Booth one more time for this excellent presentation, and hope everyone has a good rest of the day.